going to go into really looking a little bit in reflection in terms of our learning environments. And there's particular things I want to focus on. There's obviously lots of things that drives an organizational culture, but I want to obviously focus on things we don't always think about. And I want to particularly talk about unconscious bias and power, especially in line with the conceptual framework we've used earlier. And then we're going to look a little bit about survival mode in our staff on the ground. So the challenge is that when people are stressed, they're obviously much more likely to be in survival mode, and you're going to see a lot more of those behaviors we talked about earlier. And this could be anybody in the department, and that's all going to contribute to that. But sometimes the reason why people are stressed is because they're in an environment that doesn't feel safe. And bias and power is two of the things that contribute to why an environment might not feel safe for everybody. So what are we talking about? So when we talk about power and bias, we're actually talking about some of the biological drives that we have as human beings. So we all have basic physiological drives like hunger and exhaustion and tiredness, but we've also got things like a drive for tribe. So a drive for tribe we share with the animal kingdom, and you'll see here from our nice little troop of baboons. As animals, we tend to have a tendency to stick with what we know. So if you were to walk into a large room with a lot of people in it, you don't know anybody, maybe at a conference or something, you're going to be more drawn towards people who are like you, either speaking the same language or working in the same discipline or roughly the same age, maybe the same race, maybe the same personality, but things that are familiar to you, you're going to feel slightly safer with. And the opposite of that is when you see somebody that you don't, somebody that's very unfamiliar from you, there's a tendency to be a little bit less, feel a little bit less safe. Now, this is not rational, okay? Just because somebody looks like you does not mean that they're a safe person. But we have an instinctive tendency to assume those like us is going to be friendly. And if somebody's not like us, we are naturally suspicious. And of course, as human beings, every single day, and as adults, and especially living in a global world and a country like South Africa, we are actually very good in our executive modes to keep a little bit of a tap on that. So when you meet somebody that's very different from yourself, there's part of you that has to recognize your initial suspicions or prejudice is probably linked more into this sort of drive for tribe. But we also have a drive for power. So if you think within any society, the more power you have within a particular society, the safer you will be. So this can be political power, the higher you are up within managerial structures or political structures, financial power, the more money you have, social power these days, so the amount of likes you have on your page, on your media. And just like with a drive for tribe, we have a slightly irrational belief that people that are not like us are not completely safe. Similarly, our drive for power means we have a little bit of an underlying irrational belief that some people have more right to opinion, resources, decision, and that usually includes me and my own. And so this is also something that we have to be very conscious with. So similarly to our subconscious emotions, whether we like it or not, these drives exist. And whenever you actually meet somebody for the first time, there's a little bit of a power adjustment that goes on if we try and figure out how safe we are within that relationship. So I always, I teach this in all kinds of different settings in terms of understanding what happens now when you combine bias, so this natural thing to be suspicious of somebody that's not with you, with power within a particular society. And the Wheel of Power illustrates this beautifully. This is from the refugee world, and it speaks about certain unearned advantages that puts you closer to the center of power in a society. And with power, I mean your ability to either change the world you live in or to change your own life. So how much power do you have to actually have agency in your life? And then you also have a whole lot of unearned disadvantages that you are either born with or born into that puts you more on the margins of power, makes it less possible for you to actually affect the world that we live in. And when we talk about intersectionality, so you've all heard about marginalized groups and the words intersectionality, that speaks about how these intersect. So the more of these central qualities you have, the closer you are to the center of power. And the more you sit around the margins, the and the more of these intersect, so more of these different qualities you have, the more vulnerable you are within a society and actually being able to affect change and affect power. So I always use Trump for an example for this, because it's such a beautiful example in terms of talking about power. And you can see their qualities. He's white, he's a citizen, he's a cisgendered man, he's English, he's rich, he owns property, slim. I'm not sure about robust mental health, but he thinks he has a robust mental health. He's neurotypical, heterosexual, able-bodied, and I don't know, maybe he has a post-secondary education, but he certainly ticks most of those boxes. What's interesting with Trump is that all of the groups that's currently being marginalized within the USA, it almost ticks every single box sitting on the outskirts of this particular. So from your undocumented migrants, the transgender people that he's persecuting, your non-English speaking poor people, homeless people, and then in terms of the mental health, the sort of their priorities in terms of their Medicaids, your vulnerable mental health, your significant neurodiversity, people who are lesbian or asexual, your disabilities, your elementary educations. At the moment in America, the more of these that intersect, the more vulnerable you are in terms of access to things, for example, like healthcare. So we can also then see that depending on whether you are looking at the world from a survival lens, or if you're looking at the world from an executive's lens, you will actually have two different ways in how you view human beings within society. So our survival way of looking at the world, and we all have this a little bit, is an elitist view. And it basically believes that some human beings have more value than others. And on a very basic level, all of us sometimes have that experience. And then if you have a society that's built on that, it means then that those with power will then decide which varieties are acceptable and which ones are not. And this is usually based on their own biases. Those that are not like me, I'm going to put lower down, give them less value than people who are like me. And so any systems of classification, marginalization, discrimination, oppression is always based on that assumption. Some human beings are more valuable than others. The opposite of that is an egalitarian view, and that is the view from our executive brains. And that's actually the understanding that all human beings have equal value. This is quite a, I could almost say, philosophical view of human beings, because it's very different from what our survival system, the survival of the fittest, is trying to tell us. And it's recent. So this is when we start to aim to create a society in which everyone has opportunity and is able to participate. So if we look then at how these paradigms would structure society system, what we have been doing, and we've been doing this for centuries, is mostly we've been living in hierarchical societies that are elitist driven. So the elitist principles has built the world that we lived in. So for example, there's always a pyramid structure. Your most powerful sits at the top. All the resources get pulled towards the powerful, and the powerful decides who fits where in that pyramid. So in the old days, it would have been a king or a chief at the top. In the modern system, in the old Indian system, there was the caste system with your untouchables at the top, at the bottom, and your Brahmins at the top. Authoritarianism, apartheid and Nazis was always both good examples of that. But now in the USA, we've got an excellent example of exactly what authoritarianism looks like. And what's interesting is that capitalism, of course, is very much a hierarchical structure. It's based on the fact that people with money have a lot more power than those without money. I want to show here, and this is not a reflection on good or bad, but the reality is this is the way we've run the world. And all of our bureaucratic and academic institutions, including our whole government structure, is based on this hierarchical way of looking at the world. So you will have your people with the most knowledge in the universities, for example, will sit at the top of that pyramid, and then usually your students will be on the bottom rung. And this in itself is not necessarily good or bad, but we have to be aware that we have these structures that are around which society has been built, and very much colonialism has sort of built those across the world. So the opposite of that would be an equalitarian society. And so South Africa is actually extraordinary because we're one of the few countries in the world where that egalitarian principle of everybody having the same value is actually embedded in our constitution and protected by our constitution. And out of that, we have these principles that we are now applying. So even in our very hierarchical academic institutions, we believe in the principles of an egalitarian society, which celebrates diversity, which believes in equality and equity, which looks at inclusivity. And so these concepts of democracy, liberalism, human rights are all based on these egalitarian principles. Whenever we talk about ethics and the ethical principles, they are always part of that egalitarian paradigm. They don't actually belong in hierarchical societies. And it's interesting to see that with Trump now, who is building an authoritarian system, how DEI is actually the acronym that he is targeting in America at the moment, and all of those systems are being dismantled. I think what we're seeing in the world of today is that as a human race, I think in South Africa especially because we have this as such a vision, you talk about DEI and just about every structure, ethics is such a big part of how we think about the world, but actually it's extremely recent. So women only got the vote 100 years ago. In South Africa, that was only white women. Democracy in South Africa only happened 30 years ago. We've had same-sex marriage only for the last 20 years. And so you can see as a human society, although we've started moving towards inclusive societies, actually globally, we are still very much on this side of the balance. What's interesting with democracy, and we can see this with countries who have adopted democracy, so that's the one person, one vote, so that's the principle. We all have the same value to have a say within our country. But of course, as soon as you have a capitalism system on top of that, you still have those with money will have power to actually affect what happens within that democracy. And you can see in somewhere like America, where it's not been protected at all, how easily democracy then falls. So this is just something I wanted to reflect about, because this plays in very powerfully within our learning environments and within our academic environments. And what I am going to assume that most of us are actually going to find we tick the high power and average power boxes. So I just want you to look at each of these three lines and just to be aware of where you are sitting in terms of race, citizenship, in terms of gender, in terms of sexuality, language, and how much money you have, whether you're neurotypical. Neurodivergence refers to autism and ADHD, for example. Whether you're able-bodied or whether you have disability. And of course, all of us here have a post-secondary education. So within the department, there's a lot of, apart from your status as the senior consultant, there's a lot of other things that actually makes you powerful even within the society that you live in. And what's interesting to reflect on when you look at your department as a whole, and that includes not only your registrars, but the nurses you work with, people from other disciplines that you work with, is people who are within this low power category. So do you have how, and especially if those start intersecting. So if you've got somebody, for example, who's autistic and transgender and does not have English as their first language, maybe they've got some learned English, they might be one of the junior people in your department, that makes them actually particularly vulnerable to this power difference. So this is something we need to be aware of and we need to be speaking about openly. And then we were talking, so both this bias and power then creates a particular environment and how safe people feel. And so let's start looking a little bit at the stress levels within a department. So your challenge is now you might have somebody who feels unsafe or stressed for whatever reason. It might be one of those junior people I've spoken about. That might trigger a particular emotion, which is going to trigger one of those behaviors we talked about earlier. The challenge with this behavior now is it makes other people feel unsafe around them, which triggers emotions in those people, which triggers more of those behaviors, which is now going to feed back into the cycle. And so very simply, it's actually stress that creates this toxicity, which creates more stress. And very important, it's not just the fact that there is stress, because medicine is a very high stress job, but the way we manage that stress and the way we behave when we are stressed that is causing the trouble. So you need to also be able to think to yourself, well, why are my clinicians stressed? And of course, it has anything that's going to make them feel unsafe. So if they are physically feeling threatened, hopefully not too much of that, but verbal abuse and things like that also counts as physical threat. But anybody who's emotionally not feeling safe and not feeling included, not feeling welcome, for example, within your department, or anybody who is not respected or is feeling humiliated or insulted because of who they are. So anything like that can make people feel unsafe. And of course, within that is your actual working environment. So if you do not have enough time, if you're exhausted, there's all kinds of underlying factors that's going to make you much more vulnerable to this threat. So not everybody is equally resilient, and we tend to have resilience up as this big badge. We're all supposed to be really tough all the time and just suck it up. But the reality is there are different people with different levels in terms of how much they can cope with, and we have to be sensitive to that. And I always get frustrated when we use the word sensitive as if it's a bad thing. Oh, don't be so sensitive, or they're just too sensitive, or they're talking about the snowflake generation. But part of inclusivity is understanding that people have different levels of sensitivity. And in general, our junior staff are generally just going to be much more vulnerable, that we talked about earlier. Apologies for the spelling mistake, and therefore much more vulnerable to threat, much more likely to get stressed. Personal circumstances is going to impact on what they bring to work. So if they've got difficulties at home, if they've got relationship problems, if they've got financial stress, they might have gone through trauma or abuse or other things that's happened that you don't know about that might get triggered. They might be going through really bad physical or mental health issues. They might even be on treatment for depression or other medical illness. And then neurodiversity, there's quite a lot of our medical colleagues that actually has autism and ADHD. We're getting better and better at diagnosing those. Something that's quite interesting is something called RSD, which stands for rejection sensitivity dysphoria, quite common in ADHD, and we see it a little bit as well in our autistic colleagues. And it's partly to do with the way they process information, but also partly to do with the way they've been treated all their lives because of their neurodiversity, but meaning they're extremely sensitive to being criticized or being shown up or being shown to not be adequate in some ways. And therefore, we have to become better in how we actually communicate with those people. And I think we want to move past a paradigm of, no, if they can't hack it, they shouldn't be in medicine. I think we need to be able to create environments where actually everybody is able to be safe. So if we want to shift these toxic work environments, there's a couple of things we can look at. And again, this is something that needs much, much more research. So what do you do if you're in an environment that's just not what you would like it to be? And I'm going to go through each of these. So we're going to talk a little bit about the physical factors. I'm going to talk a bit about role modeling, and then we're going to talk a little bit about sort of team building. So firstly, very important is we actually obviously need to look at our working environment from a physical point of view. The commuted overtime has recently brought a lot of this into, we've really had to sit down and see how many people do which hours where. And just we all know that if you've been on your feet for too long, you actually are no longer, they actually shown that if you've been awake for more than 21 hours, it's like you're over the limit in comparison with somebody's blood alcohol level. And I think it's useful to get feedback from staff actually on working conditions and how they might be able to, how do we address the flow or the dynamics within the department? What system things can we address? Not always so easy. But the thing I think really has potential power, and it's both an opportunity and a threat, if one can put it this way, is that you can actually very powerfully affect what happens in a department by what gets role modeled. And the challenging thing is that the way the person with the most power in that department behaves has a massive effect on what happens to everybody else. So if you're the person leading the grand round and you are mean to everybody on that grand round, that is going to create a particular amount of stress and a particular amount of behavior potentially for the rest of the day. It also means that if you as a team leader on that morning has an amazing grand round where you are supportive and affirming and we're all learning together and it's exciting and we're solving problems together, that also is quite effective and creates a different way in which an department gets felt. And I've tried doing this a little bit within our outpatient department. We have a crazy outpatient department where our interns find it quite hard going. We pretty much go till 3-4 o'clock in the afternoon, patients queuing out the door. And trying to create a feeling on the floor where we're all working together and getting the job done sometimes is quite hard work. But the responsibility certainly lies with the more senior people within that department. And then thirdly, we actually need to actively build the kind of teams we want on the floor. So we always talk about all those higher values, right? We've got Bato Pele on our walls. We've got all kinds of fancy things we write down in documents. But actually, as part of our CPD meetings and part of our communication, for example, to our interns when they come into the department, that we actually talk about what we mean when we say inclusivity, what we mean by respect, what we mean by generosity, for example. And that this becomes values that we believe in the department and that we actually sort of expect from everybody. So one of the ways of doing that is I actually do a 1 hour CPD talk that includes a lot of the stuff we've just covered on learning environments. And it's a little bit about having that language within a department. What kind of emotions do we want to build in this department? What kind of interactions do we want to build in this department? And actually building those as a vision. One of the things that really helps, and that's what we're going to focus on in the next session in 2 weeks' time, is actually learning feedback methods that changes the way we talk to each other. So there are particular ways of giving feedback that makes people learn and makes them feel better out of coming out of an interaction. And there's definitely ways of getting feedback that can ruin somebody's day and cause a lot of stress. So we need to be constantly giving our young doctors feedback. They need to be constantly learning, but we can learn habits of how we do that can change the atmosphere within a department. So we really want to look at how do we create those positive emotional spaces. And if we think back to our 3 positive emotions, so how do we create caring emotions? So is there also access to people nurturing, that we can nurture each other? It's not always so easy. In my busy OPD, there's very little time for patting people on the shoulder. But is there possibilities for counseling? Is there possibilities for support? And we've talked quite a lot in some of the sessions on debriefing. So debriefing needs to happen in a way that really brings that care in and looking after people's emotional spaces when we debrief and having some expertise in how to do that. Creating some social interactions. So our interns come around on 2 monthly basis. Today was their last day in my department. So we always have a little party on the last day with them and bring some food and create some sort of positive interaction just as human beings. And then I talked about that lovely positive emotion of seek, on how do we create this atmosphere of learning, teaching, and these key emotions that we need as the basis of the atmosphere. And we are here to solve problems. We are here to learn. And how do we build those motivational spaces? So we're going to do another little exercise now using my Slido. And I want you to think of one of the environments that you work in. So this can be a particular hospital you are at. It can be a particular ward that you are in. Perhaps think of a particular working team. If you're in a surgical anesthetic field, it might be a particular theater team that you work with.